After another day of parliamentary hearings, questions surrounding Victoria's disastrous hotel quarantine program are still without answers. Today, the Jobs Minister batted away suggestions his team was to blame. And the Premier has rejected claims the ADF was offered up to run the program. Away from the politics, it's been another bad day numbers-wise. 410 new cases have been logged, slightly higher than the past few days, but still stable according to authorities. Sadly, another 21 people have died, a new daily record. That means in the past week, coronavirus has claimed the lives of more than 100 Victorians. And yet, still, people continue to flout the rules. Police have issued 184 fines in the past day, 24 for not wearing a mask and 58 for breaking curfew. Mary Gearin begins our coverage.
Breaking curfew after skyfall. Two international students mocked Melbourne restrictions in their video posted to social media. The pair was slammed by the Chinese community. Within hours, they turned themselves into police and were fined. Sudden confessions, though, were not forthcoming at the parliamentary inquiry.
Which minister is ultimately responsible for hotel quarantine program?
I'm not going to engage with you on what can only be described as a sort of a gotcha type question.
But the Jobs Minister did say hotel infection control was the domain of the Department of Health and Human Services. And his department secretary pinpointed a meeting in March at the State Control Centre that led to a pivotal decision.
The decision to use private security came from the 4:30 meeting on the 27th.
That meeting was chaired by the Emergency Management Commissioner Andrew Crisp, who today backed the Premier's claims that Defence Force support in hotels was never on offer. He said the ADF was involved in initial planning discussions, but that he did not seek, nor did the ADF offer, assistance as part of that program. The Premier wouldn't be drawn on contradictory comments from the Federal Defence Minister.
Andrew Crisp has issued a statement. I don't think it could be clearer or plainer.
It was also revealed the Jobs Department called for police to monitor hotels early on in the process.
We raised it. The Deputy State Controller, what he did with our concerns, I'm unsure.
Another day with no clear answers about hotel quarantine, and the appearance of the Emergency Management Commissioner at the inquiry in a fortnight is shaping up to be crucial. Away from the retrospectives, the Premier is next week expected to deliver more detailed data about how people in certain workforces have contracted the virus. And there are early indications about the more than 1,000 active cases among healthcare workers.
Our early analysis by our expert team is showing that the majority of healthcare workers are acquiring coronavirus outside of the workplace.
Meanwhile, as life in our streets and our suburbs powers down, new modelling predicts unemployment in Victoria could peak at 11% by September, with 325,000 Victorians set to lose their jobs because of the pandemic. JBS Australia has confirmed it's shutting down its meatworks in Brooklyn and standing down its workforce until that elusive time that the virus is contained. Mary Gearin, ABC News, Melbourne.
And our state political reporter Richard Willingham joins me now. So, Rich, the political tensions seem to bubble over today. Walk us through what happened.
Well, Tam, the toing and froing has been escalating for some time now, for some weeks. It really has boiled over now. I think probably perhaps because the lockdown has taken hold and there's more focus on that blame game. And the comments from Premier Daniel Andrews yesterday that he didn't think ADF support was ever offered to Victoria have really sort of spurned this on. Now, accountability is very important for our political leaders, but there are some in the community that don't want this politicking right now. They want all the focus to be on fighting this pandemic. Others have been baying for political blood, including some more outspoken members of the state opposition. Until now, opposition leader Michael O'Brien has resisted urges to call for the Premier's head. But following those comments about the ADF support, Michael O'Brien says it's now time for the Premier to go.
We must have leadership that Victorians can trust. And sadly, yesterday Daniel Andrews proved he's not that leader anymore. So I do think it is the best thing for Victoria for the Premier to consider his position.
I would have thought it was pretty obvious who was focused on the politics and who's focused on the global pandemic. That's my job and I won't be changing my approach.
Rich, the hotel quarantine issue is the major point of contention, but we still don't have any meaningful answers. When are we likely to get some?
Well, that's the big question, I think, on a lot of people's lips, and it's also the source of tension within the state government and with the federal government. The ABC understands 100 ADF personnel were put on standby to help with Victoria's hotel quarantine in March, but they were never used. Now, the ABC also understands that the ADF were involved with the planning of hotel quarantine back in March, and some of those meetings took place at the State Control Centre. Now, meetings at the State Control Centre at high level are recorded as practice, and those recordings have been handed to the Coat Inquiry, which is investigating what went wrong with this program, this hotel quarantine, and as many people believe has landed us in this second wave. Now, some senior sources are saying that evidence, that video recording, may contradict some comments regarding when private security was engaged and why ADF support was not used, but that will come out in that inquiry. Now, that inquiry has its first public hearings looking at experts around genomic sequencing next week. The parliamentary hearing, the parliamentary inquiry, continues tomorrow. Tam?
Rich William, thank you. The Premier has raised concerns about the rapid increase in COVID cases in some regional cities, but he stopped short of suggesting a tightening of restrictions for them. But in Bendigo, where cases have gone from single figures to more than 50 in a fortnight, residents fear a stage 4 lockdown might be the only way to stop the spread of the virus.
Masks were made compulsory in regional Victoria recently, but when Melbourne started its second wave, the regional city of Bendigo watched on from relative safety, with just 4 active cases of COVID-19. 3 weeks later, case numbers have raced above 50, and residents are nervous.
We've seen this thing grow like a bushfire and take off quite rapidly.
I don't see it getting better in the next few weeks. I think it's just going to get worse.
While most of the positive tests can be traced back to Melbourne, authorities are concerned about an increasing number of mystery cases.
There are a smaller number of cases which we've been unable to identify the point of acquisition for the illness. So that is a concern.
A contact tracing team has been established in the city, and just as they did in Melbourne, they've come across cases of people not self-isolating at home when they should be.
They are not hugely common, but they are a serious risk, and we just ask people to do the right thing.
Bendigo is under stage 3 restrictions, but some experts want Melbourne's stage 4 lockdown extended to regional hotspots.
I haven't had any indications about stage 4. Certainly we'll be having discussions if that was to arise.
But the Premier says there are no plans to do that yet.
The reports back and the compliance data shows us that regional Victorians are doing the right things.
The Premier has also raised concerns about Geelong and Ballarat's case numbers, and Bendigo's experience serves as a warning to other regional cities as to just how quickly a COVID-19 outbreak can take hold.
I think the numbers have maybe shocked people and made them more aware, and I think that's what's given people the hypervigilance now that we know that needs to happen.
A city on high alert. Tyrone Dalton, ABC News, Bendigo.
A major hospital on the Victoria-New South Wales border says it'll be forced to send patients who need urgent medical assistance up to 2 hours away for treatment. More than half of Albury-Wodonga Health's emergency department and intensive care unit doctors are locums who travel from Melbourne on temporary rotations. But they're now banned from crossing state lines under the latest public health order. Ashley Aldridge reports.
Within weeks, Albury's hospital will lose its current crew of Victorian locum doctors when their 6-week rotation comes to an end. But their scheduled replacements won't be allowed in, and that's thrown the health service into crisis.
With the critical services permit, there are restrictions on, obviously, people travelling up from the hotspot in Melbourne.
Albury-Wodonga Health covers both sides of the border. The Wodonga campus specialises in obstetrics. Albury takes care of paediatrics, ICU and emergency. Because the system is run by Victoria, the Albury Emergency Department uses locum doctors from south of the border. When that border closure tightened on Friday, it locked Victorian doctors out, meaning the hospital may have to divert emergency cases on the New South Wales side to Wagga, 2 hours away by road. Albury-Wodonga Health says the emergency department could start to be impacted from as early as tomorrow, while services at the intensive care unit could also need to be reduced within the next 2 to 3 weeks. The restrictions between the two states are also taking a toll on the nursing staff. The spike in COVID cases among Victorian healthcare workers is a serious concern north of the border.
We want to try and keep this hospital COVID-free. The nurses are certainly, we're all banding together, we're all doing covering shifts where we can.
New South Wales Chief Health Officer Kerry Chant says the health service is being offered support so they can continue critical services.
That includes providing details for locum agencies within that operate in New South Wales and assuring those locums from New South Wales that they don't have to self-isolate if they go and do shifts in the Albury-Wodonga Hospital, given it's in that precinct in the border.
But finding replacements from New South Wales or even other states won't be easy in such a short space of time. Ashley Aldridge, ABC News, Albury.
Travel restrictions on Victoria's border with South Australia will get even tougher next week. At the moment, Victorian residents who live near the border can travel into South Australia for work, education, medical treatment or to buy food and supplies. But from next Friday, the only exemptions for essential travel will be for farmers with properties in each state and Year 11 and 12 students going to school.
We understand that this is going to have an impact on those close border communities, but given the current status of COVID-19 in Victoria and the current numbers, it is deemed that this is a critical step to ensure the safety of the South Australian community.
Medical exemptions will be considered on a case-by-case basis.